So I have assessed vitals on my patient already. I have looked at the patient's chart, noted anything that's abnormal, and then I'm going to come into the room. Privacy is being provided. Come into the room and say, "Hi, my name is Luke. I'm going to be RN today. Can I get your name and date of birth, please?"
Carmiel West, 0504 1998.
Can I just look and see that that's right? Good, it is. What brings you in today?
Just a physical assessment.
Okay. We're gonna be doing a head-to-toe assessment today.
Okay.
I'm gonna ask you some general questions real quick. Do you know where you're at?
Yeah, Bellevue College Hospital.
Good. Do you know what day it is?
I think it's the 5th
It is. Good.
of
Okay.
October.
Good. Patient is ANO times 4. I'm gonna do just a few more general questions. Any recent hospitalizations?
Nothing recent, no.
Nothing recent. Anxiety, depression.
I'm not dealing with any of that right now. No.
Good. Okay. Any spiritual needs that you want us to take care of?
Nah, not very spiritual. I think I'm okay.
Okay, good. And then the most important question: any pain? 0 to 10. 0 being the worst, no pain. 10 being the worst amount of pain you
No
possibly feel.
pain at all right
No
now.
pain in anything. That's perfect. Shortness of breath.
Nope.
Good. Okay. So the first thing we're gonna do for the assessment, I'm gonna raise your head up just a little bit.
Gotcha.
I'm not that tall, so it's not that hard. Is we're going to assess your cranial nerves
Okay.
and neurological assessment. This is a little slow. That's all right. You comfortable?
Yeah, I'm doing good.
Good. Clean
My
this
feet
off.
are oddly up right now.
I'll put them down. That makes you a little more comfortable. Clean my stethoscope real quick. Okay, so the first nerve that we're going to be assessing is going to be cranial nerve 1, which is your olfactory nerve. I'm just going to have you close your eyes for me. I'm going to have you tell me if you can smell anything, all right?
Yeah, I smell alcohol.
Good. Cranial nerve 1 is intact. All right, we're going to move on to cranial nerves 2, 3, 4, and 6, which are the optic, oculomotor, trochlear, and abducens. I'm going to have you just look right over my shoulder real quick. And I'm just going to shine this light to test pupillary response, all right? Good. Good. Keep your eyes on the pen. Don't move your head, just follow the pen with your eyes, all right?
Mm-hmm.
Ready? Good. And last but not least, focus on the tip of the pen. And I'm just going to move it closer to your nose. Just don't stop following it as it gets closer, all right? Good. All that seems normal. We're going to move on to facial, which is 5 and 7, trigeminal and facial nerves. So I'm just going to have you smile for me, frown, puff out your cheeks, and then I'm going to have you lift your eyebrows. Okay. I'm going to have you close your eyes again for me one more time. I'm just going to test sensation on your face. Just tell me where you feel, all right?
Middle of my forehead, left cheekbone, right cheekbone, middle of my chin.
Good. We got sensation. We'll do cranial nerve 8 real fast, which is vestibulocochlear. That's audio. I'm just gonna have you close your eyes one more time, and then I'm gonna make a light noise. Just tell me which side you hear it on, okay?
Left side, right side, both sides.
Good. We'll move on to facial for the mouth, which is 7, 9. 7 is facial, 9 is glossopharyngeal, 10 is vagus, and 12 is hypoglossal. I'm gonna have you stick out. Oh, actually, where did I put it? I'm gonna have you stick out your tongue and go ah. Good. I'm gonna have you move your tongue side to side. Good. Can you tilt your chin up for me? Swallow. Trachea is midline. I can see the neck. Everything looks normal. Good. And then the last we'll do is repeat the phrase light, tight, dynamite.
Light, tight, dynamite.
Perfect. Last facial nerve, cranial nerve, not facial nerve, cranial nerve that we have to go over, is going to be 11, which is accessory. So I'm just going to push down on your shoulders and just shrug up. Okay, give me some resistance. Perfect. Sound looks good. We're going to moving on. Those are done. I'm going to be moving on to cardiovascular and then lungs. So I'm going to listen to your heart and your lungs. But first, I'm just going to ask you a few questions. Do you smoke? History of smoking?
I smoke, yeah.
Okay, how often?
Not very often anymore.
Not very often. Pack a day?
Not way less.
Half a pack a day?
Not even.
Pack in a week?
Not even.
Okay, so we can get those questions out later. It doesn't seem like you smoke all too often. Okay. Hypertension.
Yes.
You have history of hypertension.
Yeah, since I was like 20-ish.
Okay. I'll note that as well. Family history of anything serious like heart attack, stroke.
Nothing of the sort so far.
Okay. And then I think that's enough for that. I'm just gonna listen to your heart now. I already cleaned off my stethoscope. I'm just gonna listen to your heart real quick just to make sure it's normal, rhythm, etc. I'll start here at the second intercostal space, right sternal border. This is the aortic valve. Sounds good. Second intercostal space, left sternal border, pulmonic valve. Third intercostal space, Erb's point. Good. Fourth intercostal space, left sternal border, tricuspid valve. And fifth intercostal space, midclavicular line, mitral valve, or the point of maximum intensity, impulse, whatever everyone calls it. Good. Everything sounds normal. I'm going to switch real quick and just hit everything again with the bell, just to listen to S3 and S4 or any other abnormal sounds. But I won't take forever on that. Just a quick touch on each point. Good. I'm going to listen to your lungs next. But before I do, I'm just going to ask a few questions on the lungs. I think I already asked you if you smoked, so we covered that. You didn't say you had any shortness of breath, do you?
No shortness of
Does
breath.
it hurt when you breathe?
Nah, not at all.
Are you having any like mucus or anything that you notice when you cough or anything
No,
like
nothing
that?
like that.
Okay. Just a few questions. Should get some normal sounds now. I'm just going to listen to your lungs real quick. I'm going to start here at the apex of the lungs, superior to the clavicles. When I put my stethoscope on, you can just give me a big in and out. Good. Good. Second intercostal space. Left and right and left. Good. Fourth intercostal space. Right, left. Sixth intercostal space. And then mid-axillary line on either side. Around the sixth intercostal space as well. Sounds good. I'm going to move on down to your abdomen, all right? So I'm just going to expose it real quick. I'd inspect it, make sure there's no distension or anything like that. Skin looks normal. Ooh, actually, before I move on to your abdomen, I'm going to do this real quick. Can you look to the right for me? Assessing for jugular vein distension. Don't see any. Can you look back towards me in that way? Same thing on this side. And then can you look straight ahead? I'm just going to palpate your carotids. That one is good. That one is good. And I'm going to have you stick out your arms for me. I'm going to bilaterally assess brachials. Good. Rate and rhythm is symmetric bilaterally. And then radials. Good. It's also symmetric bilaterally, rate and rhythm. I'm going to get this real quick. I'm just going to test capillary refill on your fingers. Make sure it's under 3 seconds, which it is. And skin feels normal and warm. No discoloration of any kind or sinuses or anything like that. Okay, now I'm gonna move on to your abdomen. I've already assessed it, so it looks fine, it looks normal. I'm just gonna ask you a few questions. Bowel elimination, have you had a bowel movement recently?
Yeah.
You think it's normal?
Pretty normal, yeah.
Any abdominal pain?
Not typically.
Tenderness when you touch it?
No.
Okay, sounds good. I've already assessed it, so I'm just gonna move right in to listening to it. I'm gonna start in your right lower and move my way clockwise. Right lower quadrant, sounds good. If I don't hear any sounds, then I'd wait for a minute to 5 minutes depending. I can hear it, so it sounds fine. Right upper, left upper, had that right. Left lower, everything sounds good. I'm gonna palpate it real quick, so I'm just gonna give it some light pressure. Let me know if there's any tenderness or any pain.
Okay.
Start in each quadrant and move my way just like I did before. Anything, any pain, tenderness?
Nothing like that.
Okay, if there was any pain, I'd check for rebound tenderness, but there's not, so I'm not gonna worry about it. Next, I'd move down to your bladder area. Voiding, have you been semi-frequently?
Yeah, I mean, I drink a lot of
Normal?
water, so I go to the bathroom a lot.
Color,
Pretty
abnormal?
Pretty opaque.
Pretty opaque,
Or-
so
Maybe a bit dehydrated. Well, yeah, yellowish.
yellow, good.
Yeah.
Color's normal. Any odors or anything like that?
Only in the morning.
Only in the morning. Okay, sounds about normal. I'd check it as needed. I can notice that there's no Foley catheter or anything, so I think that there's no need to continue further. I'm going to expose your legs real quick. I'm going to do some few tests on your legs and on muscle function. I'm going to have you extend your arms out real quick first. I'm going to pull on them, give me a little bit of resistance. I'm going to push on them, give me a little bit of resistance. I'm going to have you grab my fingers just to touch the grip strength. Give them a good squeeze. Perfect. And then I'm going to just have you tap the pads of your fingers. Perfect. I'm going to do that on lower on your thighs. So just lift up one at a time. Good. Lift up. Good. Lift up. Lift your shin. Try to get your whole leg. There we go. And again. Perfect. As I'm going down, I'd notice hair distribution, color, all looks normal. It's warm to the touch. No edema. Nothing abnormal. I'm going to test Babinski's reflex. Well, actually, I'm not going to do that first. I'm going to have you pull up on your feet, push up on my hands, push down on my hands. Good. And then push out on my hands. Perfect. Sounds good. Can you feel my fingers? Test cap reflex while I'm, or capillary refill, not reflex. Cap refill while I'm here. It's good. Babinski reflex just to make sure. Nothing. And then bilaterally on the pedal pulses. Hard to find on this one, but
mine are kind of weird.
I got it. Rate and rhythm is normal. Bilaterally, symmetric. And these are strong. On your tibial pulses, good. Okay, cool. All that's normal. I'm going to lower your bed down again. We're going to do a gait test and a balance test. And I'm also going to listen to your lungs posteriorly, all right?
Okay.
Can I just have you swing your legs out for me and sit on the edge of the bed? I'm going to start by listening to your lungs. So I'm just going to get back here. I'm just going to have you take a normal deep breath for me. Test for respiratory excursion. Looks normal. And then I'm going to have you cross your arms. I'm just going to listen to your lung sounds again from the posterior side, from your back side. Start from here at C7. Bony prominence at C7, and then go down just a little bit to the left. And then I'm going to have you take deep breaths in and out again when you feel my stethoscope, all right? There you go, mid-axillary line. It's here. You can check this just to make sure you get that middle lobe of the right lung. And then same thing on this side. Good. Lungs sound good and normal. Lastly, we're just going to do a Romberg's test to test for balance. Just gonna move this out of the way. I'm going to have you stand up, keep your arms at your side, and then close your eyes for me. Just to test balance. Looks fairly normal. I test for about 30 seconds, but it looks normal, so we'll stop there for now. And then last thing I'm going to have you do is I'm just going to have you walk heel to toe to the edge of the bed, all right? While he's doing this, I can check the back side to make sure that there's nothing there. Edge of the bed is fine. And then you can just walk on back normal. Bony prominences are good. No redness, edema, swelling of any kind. Looks normal. Okay. You can get back into bed and get comfortable however you like. I'll make sure that you have your call light. Any pain, discomfort during any of those tests?
Nah, I'm feeling fine still.
Feel all right?
Yeah.
Okay, you got your that. Your call light, let us know if you need anything. Make sure that is good. Bed is low. I should have done this first, but bed is low and locked. Then I'll do hand hygiene. And then I'll document my findings.